Last Sunday, President Trump announced the FDA had approved the emergency use of convalescent plasma to treat COVID-19 patients. That, along with greatly increased contact tracing, might turn out to be a game changer in getting and staying ahead of the virus. ONR's Rory Taylor explains what convalescent plasma is and how contact tracing works.
It's always right there.
Trevor Rogers contracted COVID-19 while traveling back in mid-March. Now, his plasma could be saving lives.
You had to have 2 negative tests in order to qualify to give it. And so I had registered early on, and I went and gave the 2 tests on a Friday at the health department. And the OBI called me about 1 o'clock on Monday, April 20th, and said they wanted me to come to Oklahoma City after 5 o'clock that night.
The urgency of that call pushed the Edmond resident to drive into Oklahoma City and donate that night. Since then, he's donated his plasma 4 more times.
Oklahoma Blood Institute has been collecting convalescent plasma since April. And we've been collecting that from recovered COVID-19 patients as well as those who may have tested positive for the antibodies.
Up until this week, giving the convalescent plasma to suffering COVID patients was only allowed in specific trial programs, like the one Dr. Jordan Metcalf of OU Medicine helped to conduct.
So you're taking what we call antibodies from plasma that people generate to try and get rid of the virus, and you're giving them to people who have not developed the antibodies yet, who are still ill with the virus.
The study, due to urgency, was conducted without a control. The potential treatment for the virus was not withheld from people it could be given to. That lack of control has caused some questions as to the validity of its findings, but the data that was collected shows promise.
They have taken the data from comparing people who got the plasma early, people who got the plasma late, and people who, in both groups, that either got plasma that had what they define as a high level of antibodies, a medium level of antibodies, and a low level of antibodies. And they found that if you get it 3 days or earlier after you get the diagnosis of COVID, and if you get a high antibody titer, you do better than if you get a low antibody titer, i.e. you don't get much antibodies from the plasma and you get it late.
This week, the FDA gave the treatment the green light. Well, maybe a yellow light.
It's called emergency use authorization. So it's not full approval yet. Okay. However, because we have gotten that authorization, we're hoping that more patients will be able to receive this product.
You know, people are always going to argue because there wasn't a control group, but I think it's done about as well as they could have done it under the circumstances, considering it's a new disease, pandemic, no effective therapies.
Convalescent plasma isn't made in a lab. The much-needed antibodies come from people who have had the virus and their body has fought it off, which means donors are needed.
Everyone would like to think, given the opportunity to make a difference, they would, but really in life, you don't always get that chance. And really, short of pulling someone out from in front of a moving train, this is pretty simple. It cost me a couple hours every week. And my doctor told me, he said, you know, I know you don't know this, but you really could make a difference in someone's life. And so it seems like a pretty small price to pay.
Fighting the coronavirus is a two-front war, though. One front is treatment, and the other is prevention. And as treatment improves, prevention has been moving forward with increased contact tracing throughout the state. Eddie Withers is an epidemiologist with the Oklahoma City County Department of Health.
It essentially starts when someone goes and gets tested. Once they're tested and they test positive, that lab report is then sent to the state, which the state then divvies it out to each jurisdiction. So then that comes to us, and then from there we make phone calls to these individuals, and through a conversation with them, we determine who they had close contact with in a certain period of time.
Once the Department of Health has that information, they reach out to the people who are in contact with the person who tested positive. One such call was received by our eCapital colleague, Sean Ashley.
Got a call from a county health department official who indicated that I had been identified as someone who was likely exposed to COVID-19. Of course, I knew that already because I had covered the press conference where the governor announced it.
You know, the key to stopping any type of a virus obviously is identifying people who are A positive and those who are exposed because you want to stop the transmission.
After alerting people that may have been exposed, the call centers continue to check in over a 2-week period to see if the exposed person is quarantining effectively or developing any illness. Oklahoma has roughly 700 contact tracers right now, with more in training every day. This work, coupled with willing plasma donors like Trevor Rogers, is creating hope that COVID-19 can be managed and contained until a vaccine is available.
Good?
Yeah.
Sweet.
Wonderful.
Rory Taylor, The Oklahoma News Report.
Pressure was on.